take a quick look at your ankles for a moment. Not later today, right now. If your socks leave deep marks by the evening, your shoes feel tighter than they did this morning, or your ankles seem puffier than they used to, your first thought might be, is something wrong with my heart? That's a common fear, especially after 60. But what if I told you that, in many cases, swollen ankles are not caused by heart disease at all? The real reason might be hiding in a part of your body that most people have never even heard about. It's a system that quietly works every minute of every day. Yet it rarely gets any attention until it starts slowing down. And when it does, one of the first places you may notice the effects is around your feet and ankles. Today we're going to uncover what that system is, why it often changes with age, and what simple daily habits may help support its natural function. More importantly, we'll also talk about the warning signs that should never be ignored. Because while swelling is often harmless, there are situations where it can signal something much more serious. I'm Dr. Kalvin Stone, and for many years I've worked with older adults who wanted clear, practical explanations, not confusing medical jargon. One thing I've learned is that many people leave appointments relieved their heart tests are normal, yet frustrated because their swelling hasn't improved. They know something doesn't feel right, but nobody has explained what else could be happening. If that sounds familiar, you're certainly not alone. Here's something that surprises many of my patients. Your body actually has two different circulation systems. Most people know about the one powered by the heart, which carries blood throughout the body. But there's another network that has an equally important job: collecting extra fluid, helping remove waste products, and supporting your immune system. This network is called the lymphatic system. Unlike your heart, however, the lymphatic system doesn't have a powerful pump. Instead, it depends largely on your muscles, breathing, and everyday movement to keep fluid flowing. As we get older, those natural pumps often become less active, not because people are lazy, but because arthritis, balance concerns, old injuries, or simply spending more time sitting can reduce movement without us even realizing it. That's where things become interesting. Imagine a neighborhood with excellent drainage after a heavy rain. Water disappears quickly because everything is flowing properly. Now imagine those drains becoming partially blocked. The rain itself hasn't changed, but the water begins collecting in the streets. Your ankles can experience something similar. Throughout the day, a small amount of fluid naturally leaves tiny blood vessels and enters nearby tissues. Under normal circumstances, the lymphatic system gathers that fluid and returns it to the bloodstream. But if that process slows down, some fluid may remain in the tissues, especially in the lowest part of the body where gravity is constantly pulling downward. That's one reason swelling often becomes much more noticeable in the evening than first thing in the morning. Many people tell me, when I wake up, my ankles look almost normal. By dinner time, they're twice the size. That pattern itself offers an important clue. Now, I want to be very careful here. Swollen ankles are not always related to the lymphatic system. Heart failure, kidney disease, liver disease, certain medications, vein problems, infections, and blood clots can also cause swelling. Those conditions deserve prompt medical evaluation and should never be ignored. But when heart and kidney tests are normal, swelling affects both ankles, gradually worsens during the day, and improves after resting with the legs elevated. Healthcare providers may also consider other causes, including changes in the lymphatic and venous systems. Understanding that difference can help replace unnecessary fear with informed action. Another reason swelling becomes more common after 60 has to do with changes that happen almost everywhere in the body. Blood vessels gradually become less elastic. Muscle mass naturally declines unless we actively maintain it. Balance issues may reduce walking. Even the sensation of thirst often becomes weaker, making mild dehydration more common in older adults. Each of those changes may seem small on its own. Together, however, they can create the perfect environment for fluid to linger where it shouldn't. Here's another misconception worth clearing up. Many people think drinking less water will reduce swelling. It sounds logical, but the body is far more complicated than that. Unless you've been told by your healthcare provider to restrict fluids because of a medical condition, staying adequately hydrated helps support many normal body functions. Dehydration doesn't simply remove excess fluid. It can affect how efficiently different systems operate throughout the body. That's why quick fixes rarely solve the underlying issue. The goal isn't simply getting rid of fluid. It's helping your body manage fluid the way it was designed to. Now, Before we talk about the simple morning routine that many physical therapists recommend to encourage healthy circulation and gentle movement, there's one important question we need to answer. How can you tell the difference between ordinary age-related swelling and swelling that could signal a medical emergency? Because recognizing that difference could be one of the most important things you learn today. Before we go any further, let's talk about the situations where swollen ankles should never be brushed aside. Most swelling develops gradually over weeks or months. But if one ankle suddenly becomes much larger than the other, especially if it's painful, warm, or red, don't assume it's simply part of getting older. Likewise, if swelling is accompanied by chest pain, sudden shortness of breath, dizziness, or fainting, those symptoms require immediate medical attention. They can sometimes point to conditions that need urgent treatment. If, on the other hand, your swelling has been affecting both ankles, gradually gets worse as the day goes on, improves after you've been lying down overnight, and your healthcare provider has already ruled out serious heart, kidney, or liver problems, then it's reasonable to have a conversation about circulation, vein health, and the lymphatic system as possible contributors. Knowing that distinction can make a tremendous difference. Instead of worrying about every swollen ankle, you can focus on understanding what your body is actually telling you. Now let's answer the question most people ask next. If my lymphatic system depends on movement, what's the simplest thing I can do to help it? The encouraging news is that it doesn't require expensive equipment or intense workouts. In fact, one of the most effective times to encourage healthy fluid movement is before you even get out of bed in the morning. Think about what happens while you sleep. You've been lying flat for several hours, giving gravity much less opportunity to pull fluid toward your feet. That's one reason many people notice their ankles look slimmer first thing in the morning, instead of immediately standing up and allowing gravity to start working against you again. Many physical therapists recommend taking just a few minutes to gently wake up the muscles that help move blood and lymph through your legs. The first step is incredibly simple. Lie comfortably on your back and, if it's comfortable for you, place a pillow beneath your lower legs so your ankles are slightly higher than your heart. You don't need to create a steep angle, just enough elevation to let gravity work in your favor. Stay there for about a minute while breathing slowly and naturally. This isn't a miracle technique, and it won't instantly erase swelling, but it creates favorable conditions before you begin walking around for the day. Next comes one of the most overlooked exercises in rehabilitation medicine, the ankle pump. Point your toes gently away from you, then slowly pull them back toward your face. Repeat that movement at a comfortable pace. As simple as it looks, this movement activates your calf muscles. Those muscles are often called the body's second heart, because every contraction helps squeeze veins and encourages blood to move upward toward the heart. That same muscle activity also supports the normal movement of lymphatic fluid. Notice what I didn't say. I didn't say this drains toxins. I didn't say it flushes your lymph. Those are popular phrases online, but they're oversimplifications that aren't supported by good medical evidence. What this movement does do is encourage the natural muscle activity that the lymphatic system depends on. After about a minute of ankle pumps, slowly rotate each ankle in gentle circles, 5 to 10 circles clockwise, then 5 to 10 in the opposite direction. These small movements help improve flexibility around the ankle joint, while activating additional muscles in the lower leg. If arthritis limits your range of motion, don't force it. Even small, comfortable movements are worthwhile. Now here's another technique that surprises many people. Your breathing plays a much larger role in circulation than most of us realize. Every time you take a slow, deep breath, your diaphragm, the large muscle beneath your lungs, moves downward. That movement changes pressure inside your chest and abdomen, helping support the normal return of blood and lymph toward the center of your body. That's why slow diaphragmatic breathing is often included in physical therapy and rehabilitation programs. Try breathing in gently through your nose for about 4 seconds. Allow your belly, not your chest, to rise. Pause briefly, then exhale slowly through your mouth for 6 seconds. There's no need to force enormous breaths. The goal is slow, relaxed breathing rather than deep gasping. Besides supporting normal circulation, this type of breathing may also help calm your nervous system, reduce stress, and leave you feeling more relaxed before the day begins. Finally, let's discuss something many people do incorrectly: leg massage. A gentle upward massage can feel soothing, but more pressure isn't necessarily better. The tiny lymph vessels sit just beneath the skin. Aggressive rubbing or deep tissue massage isn't usually needed to encourage gentle fluid movement. Instead, using light pressure, slowly glide your hands upward, from the top of the foot toward the ankle, then from the ankle toward the calf. Always move upward toward the body. If you have fragile skin, significant pain, open wounds, or you've been diagnosed with certain vascular conditions, check with your healthcare provider before trying massage techniques. When you put these steps together, gentle elevation, ankle pumps, ankle circles, slow diaphragmatic breathing, and light upward massage, you've created a short routine that takes only a few minutes but encourages healthy movement after a night of rest. Will it completely eliminate ankle swelling? Probably not. But for many people, consistency matters far more than intensity. Small habits performed every morning often produce more meaningful long-term benefits than doing something difficult once every few weeks. However, your morning routine is only part of the picture. Because there are 5 everyday habits that may be quietly making your ankle swelling worse without you realizing it. And one of them is something millions of older adults do almost every single day. Now let's talk about the everyday habits that often have the biggest impact on swollen ankles after 60. None of these are magic solutions, but together they can support healthy circulation and may help reduce the amount of fluid that collects in your lower legs over time. The first habit is moving more often, not necessarily exercising harder. Many people think they need to walk several miles or join a gym to improve circulation. In reality, one of the biggest problems isn't a lack of exercise. It's sitting for long, uninterrupted periods. Whether you're watching television, reading, working at a computer, or driving, your calf muscles become almost completely inactive. Remember, those muscles act like a natural pump that helps move blood and lymph upward against gravity. If they stay still for hours, fluid has a much easier time collecting around your ankles. A simple goal is to stand up every 30 to 60 minutes, walk around the room, march gently in place, or perform 10 slow calf raises while holding onto a chair if needed. These brief movement breaks may seem insignificant, but they activate the muscles your body depends on throughout the day. The second habit is paying attention to sodium rather than eliminating it completely. Salt isn't the enemy. Your body needs sodium to function properly. The issue is that many processed foods contain far more sodium than most people realize. Frozen dinners, canned soups, deli meats, chips, fast food, packaged snacks, and restaurant meals can all contribute large amounts without tasting especially salty. Too much sodium encourages the body to retain more water, which can make ankle swelling more noticeable, especially by evening. Instead of trying to remove all salt from your diet, focus on preparing more meals at home, reading nutrition labels, and choosing fresh foods more often. Small changes made consistently usually work better than extreme diets that are difficult to maintain. The third habit surprises many people. It's staying properly hydrated. As we age, our sense of thirst often becomes less reliable. Many older adults simply don't feel thirsty until they're already mildly dehydrated. Unless your healthcare provider has advised you to limit fluids because of heart or kidney disease, drinking enough water supports many normal body functions, including healthy circulation. Drinking actually means. A simple trick is to keep a reusable water bottle nearby during the day, rather than waiting until you feel thirsty. The fourth habit involves something many people overlook entirely: your footwear. Shoes that are too tight around the top of the foot or ankle can become uncomfortable when mild swelling develops throughout the day. Likewise, socks with tight elastic bands may leave deep marks that make swelling appear even worse. Choosing comfortable shoes with adequate support and avoiding socks that dig deeply into the skin may improve comfort, particularly if you're on your feet for long periods. Now let's discuss compression stockings. You've probably heard about them before, and many people wonder whether they actually work. The answer is, they certainly can. Compression stockings gently squeeze the legs, helping support blood flow and reducing the tendency for fluid to collect around the ankles. However, they aren't appropriate for everyone. People with certain circulation disorders, severe peripheral artery disease, or other medical conditions should speak with their healthcare provider before using compression garments. If compression stockings are recommended for you, they're generally most effective when put on first thing in the morning, before swelling has had time to develop. Waiting until evening, after your ankles have already become swollen, makes them more difficult to put on and less effective. The fifth habit is one many people underestimate: getting enough quality sleep. During sleep, your body performs countless repair processes. Spending several hours lying flat also reduces the constant pull of gravity on your legs. Some people find that slightly elevating their feet with a pillow or by raising the foot of the bed a small amount improves morning comfort. The goal isn't to create a steep angle, just gentle support if it's comfortable for you. Now I'd like to share the story of someone I'll call Margaret. Margaret was 72 and loved gardening. Every afternoon, by the time she finished working in her flower beds, her ankles felt tight enough that she wanted to kick off her shoes the moment she came inside. She worried something was seriously wrong. Her doctor evaluated her carefully. Her heart looked healthy. Her kidneys were functioning well. No signs of liver disease, no blood clot. Once serious conditions had been ruled out, she focused on consistent daily habits instead of searching for a miracle cure. She began taking short walking breaks instead of sitting for hours. She performed gentle ankle exercises every morning. She stayed better hydrated. She reduced heavily processed foods. She wore compression stockings on days when she expected to spend several hours standing. She didn't wake up one morning with perfectly thin ankles. But after several weeks, she noticed something important. Her legs no longer felt as heavy in the evening. Her shoes stayed comfortable longer. The deep sock marks became less noticeable. Most importantly, she stopped feeling afraid every time she noticed mild swelling. That's an important lesson. Sometimes the greatest improvement isn't simply what you see. It's understanding what's happening inside your body and knowing when you can safely manage it and when you need medical care. Before we finish, I want to leave you with one simple reminder. Swollen ankles should never be ignored, but they also shouldn't automatically make you assume the worst. If swelling develops suddenly, affects only one leg, is accompanied by severe pain, redness, chest pain, difficulty breathing, or any other concerning symptoms, seek medical care right away. But if serious conditions have been ruled out, your body often responds best to gentle, consistent habits practiced day after day, not quick fixes that promise impossible results. So tomorrow morning, before you rush out of bed, spend just a few minutes giving your legs the movement they've been waiting for all night. Small daily actions have a remarkable way of adding up over time. If you found this video helpful, I'd love to know where you're watching from and whether ankle swelling has been something you've been dealing with recently. Your comments help shape future videos and may encourage someone else who thought they were facing this challenge alone. If you'd like more evidence-based health tips designed specifically for adults over 60, be sure to subscribe so you don't miss future videos. And remember, this video is for educational purposes only and isn't a substitute for personalized medical advice. If you're ever unsure about new or worsening swelling, consult your healthcare provider. They know your medical history best. Thank you for watching, take good care of yourself, and I'll see you in the next video.